Hello everyone, Body Hacks by Dr. Rob here again. And today we're going to talk about the low back. I've gotten some inquiries about back pain and people just wanting to see some things to kind of hack the low back. So I've decided to kind of tackle this big subject. When it comes to back pain, a lot of people have back pain, okay? I see a lot of patients with back pain, a lot of people walking around with generalized low back pain. You wake up in the morning, you're stiff, you have low back pain. Something that can typically work itself out, but if it's not working itself out by your normal daily activities and something that's persisting, I'm going to give you a couple little hacks that might be able to help. First off, why? Why is your back hurting? Typically your back is hurting because you are weak somewhere, okay? It is a muscular imbalance issue, all right? You have your low back here, you have the front muscles that are going to be weak, giving you a muscular imbalance problem, okay? Your iliopsoas muscle, the iliacus, and your psoas muscle, your hip flexor muscles, okay? That's a big problem. And then also with all the sitting we do nowadays with work and with just a lot of people getting on computers and stuff like that, when we sit down, our glute muscles just completely shut off. The side glute muscles, your glute medius muscles, all right, those are your hip abductor muscles. They're also, when you're closed chain, when your foot is on the ground, they help with your trunk control and trunk stability, okay? So when those are weak, your hip flexors are weak, your back is working overload, okay? Also your quadratus lumborum, these hamstring muscles of the back, okay? Those get really tight as well, okay? So, you wake up with back pain or you're having generalized low back pain, what can you do about it? I'm going to show you a couple hacks here, okay? You want to get down in what we call the hook lying position, where you're lying on your back like this, okay? So first thing what you can do is you can do some self SI joint distraction. So if you're having pain that's on those dimples of your low back, right, and you want to try and get that to feel a little bit better, this is a self distraction technique. So what you're going to do is you're going to gently push your knee forward that way towards your feet, okay? You're going to push it and hold it for a 6-second contraction hold there, and then relax, all right? Very subtle, that you might not even be able to tell that I'm doing it. That's okay, because this is a pretty good technique. And relax. You're going to do 3 6-second holds on the right, and then you're going to start on the left, all right? You're going to go 3 times, all right? 3 rounds, all right? So you're going to do 6-second holds, 3 on the right, 3 on the left. That's going to help to distract that SI joint and give you some natural distraction of the low back, okay? Another technique that you can do is you get a regular chair, okay? You either lay on the ground, or if you have the ability to kind of get it up high like this, and you want to get into a 90-90 position, okay? Where you get your legs up here, and your hips and your knees are at 90 degrees. It takes all the pressure off your lumbar spine, okay? And what I recommend doing here is finding your core muscles while you're here, okay? Because your diaphragm is loose, you're not getting gravity pushing down on it, and you can really feel your core muscles, all right? So those core muscles that you're going to be contracting here are your bladder muscles, okay? When someone says hold your core in, it's your transverse abdominal muscle, and you activate that by holding your pelvic floor, okay, people? Your pelvic floor. You got to activate those core muscles by holding in your bladder, okay? And what I do here is you just find that, and it really gives you a nice neutral pelvis, and it takes pressure off the low back. This is a kind of a quick fix method that you can do lying down. Put your feet on the couch or on a kitchen chair or something like that, or if you got the ability to do this in bed, you can do that as well, okay? The core, we talked about transverse abdominal muscle, all right? Also, the multifidi and the rotators on the spine, they contract when you contract your pelvic floor. Can't stress that enough. A lot of people have been told previously, flatten your spine or pull your belly button in towards your spine. Yeah, a lot of people will contract their butt. No. The pelvic floor, you activate that, the transverse abdominal muscle activates, multifidi rotators around the spine, sucks everything in, strengthens around the spine right there, okay? So right here is just the first part. I'm going to get into some more later on, but try these out first, and I'll see you next time.